Hi there, my name is Dr. David Josephitis. I work in Minneapolis, Minnesota with Shapiro Medical Group, and I am excited to be discussing with you today a topic that's very important and very timely. Quite often patients come to me and they ask me, is FUT or FUE right? Why are there two different techniques? Does one leave a scar? Does one not leave a scar? And so these are all great questions and we get them all the time. It's actually quite timely because over the years FUE has become quite popular. In the media, it seems to be the newest, the greatest, the best, and everyone wonders, is this FUT an old dinosaur? What is it about? Dr. Ron Shapiro and I have done quite a bit of research at the donor area. And the donor area is the area in the back of the head where you take grafts from and you'll use them to distribute in the front of the head. Usually patients need more hair than they can get. So our research was diving into how can we maximize the amount of hair for patients. In general, patients typically want more than they can get. And so the question is, should you use one technique over the other? Now, as I mentioned, FUE has become very, very popular. It's the newest thing. It's not really the newest thing, but it's the newest and greatest according to a lot of patients or potential patients. And actually our clinic has become had more and more patients that want to do FUE, so we've been doing more of them because they want it. But is it the right thing? So in our opinion, actually a combination of these two treatments in a patient's lifetime might be the best thing for a certain patient. It depends. Now, our study was focusing on maximizing the amount of donor. In general, I always like to say that patients have somewhere between 6,000 and 8,000 grafts in the back of their head. It sounds like a big number, but in general, it's really not. Most patients have about 1,000 grafts on their whole head in their lifetime, and they've lost quite a bit of hair before they're reaching our doorstep and asking us about hair loss and hair transplantation. So with regards to that, patients want to have as much hair as they can get. So in general, we think that most patients, if they're young and they have a little bit of hair loss and they're intimidated by the strip procedure, which is a linear incision in the back and a piece of tissue comes out and the grafts are dissected and placed in front. You're left with a linear scar. I actually myself had a strip procedure, and it's very difficult to find. So people like me are walking around the street all the time with these linear incisions. In general, for patients that are young and want a small surgery and they want FUE, we say, great, I think that should be fine. We'll implant into here and they should have plenty of grafts in the future. Now, if you are a patient such as a woman or someone who has long hair and you don't want to shave your hair, because remember with the FUE procedure, you need to shave your hair for the most part in general to access those grafts. So sometimes the FUT is just a great option for those patients that have long hair and they don't want to shave it. Another category of patients which may benefit from FUT and FUE are those patients that have extensive hair loss. They have front to back. We would call those in Norwood 6 or 7. So patients that really need it. Now, how many patients need it over their lifetime, the maximum amount of hair? We're not sure, but we know it's more than 0. So some patients over their lifetime require a larger amount of grafts. And in needing that, we actually, in our study, we found that when you use a combination of strip and FUE over time, not at one time, you can actually get anywhere from 2,000 to 3,000 more grafts by doing that combination. So it's kind of a profound amount of hair extra if you need it. Now everyone doesn't need it, and so I'm not saying that everyone should do this, but it's kind of something to think about, and I think it's important to ask your surgeon. It's important to ask them if they're familiar with FUT, if you're interested in maximizing the amount of grafts. FUE, is, like I said, is perfectly a great procedure for anyone who has a minimum amount of loss, who wears their hair very short, they're concerned about a linear scar. So those are great candidates for that too. But I think it should be a conversation that you have with your physician as far as what are the pros and cons of this versus this. I would recommend really doing the research and due diligence before you choose one over the other. And perhaps you'll be using both of them in your lifetime. So I think my number one tip for any prospective patient would be to talk to your surgeon about your hair loss and the future of your hair loss, because more times than not, you may need more than one surgery. Patients come to me sometimes and they think, oh, I'm going to be done with one surgery. You may need to do more over time. So plan out with your surgeon, how many grafts do you think I'll need over time? By doing so, you may realize that you might need one or the other or both techniques that I've just discussed. So it's a good idea to keep your mind open and to look towards the future and be well prepared.